Hello, my dear friends. I welcome you all to my daily dose. So, I am myself Dr. Rajesh Gubba. I am a cardiologist. So, I am also the mentor for teaching general medicine for exams like NEET PG, AIMS, PGI, and as well as JIPMA. So, as the part of today's daily dose, so here is a clinical question. So, I have a 45-year-old woman and she presented to me with unexpected weight loss, loss of appetite, and shortness of breath. She presented with this particular complaints, and I have examined her. Like when I have examined, there is reduced air entry and dullness to percussion in right lung. I have done a pleural tap, and when I have done a pleural tap, and that was sent for the analysis, and the results have been obtained that showed that the protein content is more than 30 grams per liter. And from the list below, select the most likely diagnosis. The options are bronchogenic carcinoma, congestive cardiac failure, liver cirrhosis, nephrotic syndrome, and as well as the Meeks syndrome. Right. Now, this question is basically how to approach with a patient with the pleural effusion. So now the individual is having reduced air entry and also dullness to the percussion in the right lung. So this is suggestive of the presence of pleural effusion. Right. Now what are the types of pleural effusion? So if you take the types of pleural effusion, like we have the transudative type of pleural effusion and as well as the exudative type of pleural effusion. So these are the two types of pleural effusion. This is how we classify the pleural effusion. Now, what is this transudative type of pleural effusion? What is the basic pathology? Remember, in case of transudative type of pleural effusion, the pathology is systemic pathology. That means the pathology is not within the lung per se. The pathology is somewhere in the body apart from the lung. Whereas exudative type of pleural effusion, if you see, it is the local pathology. That is, the pathology is directly within the lung or within the pleura. That is what you see in the exudative type of pleural effusion. And very important difference between these two is the protein content. So if you see the protein content in case of transudative, it is less than 3 gram per deciliter. So if you write deciliter, it is less than 3 grams, or you can write it as less than 30 grams per liter, right? Whereas in exudative, it is a local pathology that is causing endothelial dysfunction of the blood vessels, right? Endothelial dysfunction of the blood vessels. Now, when there is an endothelial dysfunction from the blood vessels, the blood vessel contain the plasma and as well as the plasma proteins. The plasma proteins, they will leak into the pleural fluid. So that is the reason why if you take the protein content here, it is more than 3 grams per deciliter. Now, because the protein content is more in the exudative type of pleural effusion, if you take the specific gravity, it is more in patients with the exudative type of pleural effusion, whereas the specific gravity in case of transudative, it is less. So these are some of the differences. Some more important differences are there which I will discuss. So this is how we classify the transudative and as well as exudative type of pleural effusion. Now you take the etiology of this particular pleural effusion. So if the question is asked to you, what is the most common cause of pleural effusion? You have to answer it as the congestive cardiac failure. And congestive cardiac failure, it causes transudative type of pleural effusion. Alright, next, if the question is asked, what is the most common cause of exudative type of pleural effusion? Then the answer should be pneumonia, right? And if the question is asked, what is the second most common cause of exudative type of pleural effusion? Then the answer will be pulmonary tuberculosis, right? So these are the etiologies based on which are the most common etiologies causing transudative and as well as exudative. But if you see this question here now, we have the options like bronchogenic carcinoma, congestive cardiac failure, liver cirrhosis, nephrotic syndrome, and as well as the Meeks syndrome. Now let me tell you that these three, congestive cardiac failure, liver cirrhosis, and as well as nephrotic syndrome, these three will cause transudative type of pleural effusion. So if it is a transudative type of pleural effusion, what does the pleural fluid contain? It contains less than 30 grams per liter of the proteins, plasma proteins. So, but what does the pleural aspirate contain? More than 30. So these three options are ruled out now. B, C, D is not the answer now. Now you take bronchogenic carcinoma, it will cause exudative type of pleural effusion, and even you take Meek syndrome, this also causes exudative type of pleural effusion. See, majority of you have the confusion, does the Meek syndrome cause the transudative or exudative? Let me tell you, Meek syndrome is the one which will cause exudative type of pleural effusion. And where is the reference from? Reference is from the Harrison 20th edition, page number 2008, right? So take that point from me. Now, so in case of exudative type of pleural effusion, like you have the protein content more than 30 grams per liter. Now, how to solve this question? Let me take up now. So, you take this Meek syndrome on one side and bronchogenic carcinoma on the other side. Now, what is this Meek syndrome? It's a triad, right? There are three manifestations. Number one, ovarian tumors, right? Ovarian fibroma. Then presence of ascites, right? Then presence of right-sided pleural effusion, right-sided pleural effusion. So this is the triad in case of Meek syndrome. Now you take the incidence between these two. Like if you take the incidence of your Meek syndrome, like the ovarian fibromas, it constitutes only 1% of your ovarian tumors. Right, like that means in case, like if you have 100 patients of the ovarian tumors, one patient will be of ovarian fibroma. Out of that, like in what percentage of patients, out of this 1% of the patients of the ovarian fibroma, what percentage of the patients will develop this pleural effusion? It is only 1%. That means, for example, if you have 100 patients of ovarian fibroma, the patients with right-sided pleural effusion will be only 1%. So now what I want to tell you here is the incidence of the Meek syndrome as the right-sided pleural effusion is very less. Whereas you take bronchogenic carcinoma causing pleural effusion, it is more common compared to that of Meek syndrome causing pleural effusion. So that is the reason why, now going back to the question now. Right, going back to the question. So now you have bronchogenic carcinoma and as well as the Meek syndrome. But between these two, which is the most common one? Between these two, the most common one is the bronchogenic carcinoma. So that is the reason why the answer will be bronchogenic carcinoma, but not the Meek syndrome. All right. So because what is the question asked from the list below? Select the most likely diagnosis. That is what is the question asked. So that is the reason why the answer becomes bronchogenic carcinoma. Now, like we have an cycle or a flow chart how to approach a case of the pleural effusion. So now you see this is a very important flow chart. Like this is how you will differentiate transudative and as well as exudative. There are three parameters which are useful for differentiating transudative and as well as exudative. Now what are those three parameters? Number one, the protein ratio. The pleural fluid protein to that of the serum protein should be more than 0.5. Next is LDH. The pleural fluid LDH to the serum LDH should be more than 0.6. And the third parameter is the pleural LDH more than 2/3 of the upper normal serum limit. Okay, so if any one of this parameter is there, then we call it as exudative type of pleural effusion. Right, we call it as exudative type of pleural effusion. If none of this parameter is there, then it is transudative type of pleural effusion. Now, for suppose now you have come to a conclusion that it is an exudative by the presence of your one of the parameter. And what is this criteria called as? This criteria, it is called as Light's criteria. So if any one of the parameter is positive, we consider that the Light's criteria is positive and we consider it to be an exudative type of pleural effusion. Right now, so once you diagnose that the patient is having exudative type of pleural effusion, then what you need to measure is you need to measure the pleural fluid glucose, cytology, differential cell count, culture, staining, and marker for tuberculosis. All these have to be checked. Like for suppose if the pleural fluid glucose is less than 60, what is that you should think of? Think of malignancy, think of bacterial infection, think of rheumatoid pleuritis. But if the pleural fluid glucose, if it is like more than 60, that means we are not coming to any conclusion based on the pleural fluid glucose. So in such scenario, you consider the pulmonary embolism and then do a CT pulmonary angiogram. If the CT pulmonary angiogram shows the presence of pulmonary embolism, then you need to treat the pulmonary embolism. Like there is no pulmonary embolism on CT pulmonary angiogram, then you have to check for the marker of the pulmonary tuberculosis. If the marker for your pulmonary tuberculosis, like you do the presence of the tubercular DNA, if it is present, that means you need to do a PCR, right? So if the PCR is positive for tuberculosis, then you need to treat for the tuberculosis, right? And if the symptoms are improving, continue with the anti-tubercular therapy. And you have done all the investigations, but you did not make out the underlying diagnosis. In such clinical scenario, you need to consider thoracoscopy or image guided pleural biopsy, right? So this is how you need to approach to a patient with the pleural effusion. So going back to our question now, so in our question, the answer is bronchogenic carcinoma, but not the Meeks syndrome. So this is a very short video on pleural effusion. I hope you might have liked this particular short video. So please follow us on the daily dose for the daily updates. Thank you very much.